Sabah VFM Experience Variety. Happy Monday, everyone. And like I mentioned earlier, we have a special guest in the studio. Two special guests. Let me introduce these guests to you guys. Our first guest is Mr. Muhammad Faisal, General Manager of KPJ Sabah Specialist Hospital, and also Dr. Chong Wei Loong, Resident Cardiologist at KPJ Sabah Specialist Hospital. How are you doing today?
Good.
Both of you.
Thank you, Effie. Nice to be here. I'm Chong, cardiologist from KPJ Sabah. I'm glad to be here.
Yeah, this is first for both of you, right?
Yeah, this is my first time on air. Am I excited?
You're excited. All right.
Hi. Thank you, Mr. Elfi. All right, for having us today.
All right. Mr. Muhammad Faisal, I want to start with you first. Maybe you can give a little bit info about yourself and also the program that you will be talking about today.
Thank you, Elfi. Okay. I'm Faisal from KPJ Sabah Specialist Hospital. I'm representing KPJ Healthcare Group actually. All right, to talk about upcoming events of KPJ Medical Symposium actually. Yeah, and today we have I have my colleague together, Dr. Chong.
Mm-hmm.
And also we talk about his expert on the heart disease.
He is the heart expert today here in the studio. So maybe just a bit about yourself first, Dr. Chong.
Yeah, I'm a cardiologist in KPJ. I manage patients with heart-related disorders like ischemic heart disease, heart failure, valve-related problems, and also rhythm problems. So I also do coronary intervention like ballooning and stenting of the vessels. I will talk more about this later.
Mm-hmm.
Yeah.
All right. So let's talk about the KPJ Medical Symposium 2024 that will take place later next month.
Next month on the 9th November.
9th November. Maybe you can give the details where, when, and a bit of what will be on the program.
All right, sure. KPJ Medical Symposium 2024. All right, so this series actually is the seventh, and will take place this coming next month, 9th November 2024, and the venue will be in Marriott Hotel Kinabalu. A full day event symposium from 8 a.m. until 5 p.m. and this actually is a platform and opportunity to all the healthcare worker to come and join, all right, with the expert and to learn about their professional developments as well, and also this symposium we offer 8 CPD points to the participants. Yeah, so basically it's a platform and engagement and sharing a venue with the clinicians and all the healthcare workers.
So 9th November that will be on Saturday, right?
Correct, yeah.
All right. So maybe many would like to know, is there any registration fee they need to pay for this symposium?
No worry at all. All right. So the event KPJ Medical Symposium 2024 that we're going to have in Marriott Hotel KPJ Kota Kinabalu is a free, open to all. Like I said just now, is a healthcare worker, the clinics, the GP, and also we invite open to all the KPJ clients and partner lah. It's free. No worry about the fees, and you just need to secure your seat, all right, by doing the early registrations that will be available at KPJ website and also KPJ Sabah official account social media.
All right. I want to ask you whether the public can join in the program. Who is eligible to attend this program? Is it open to public or is it only to certain group?
Actually, this symposium we tailored for the healthcare
Mm-hmm.
people. Is open to general practitioner, which is the clinics, corporate clients of KPJ. So whoever that engage with KPJ, we are open to come and join the sessions. And also we open for the insurance agents, which is a good knowledge for them to share with their clients.
Mm-hmm.
And also other healthcare professional like the nurses, physiotherapists, radiographer. And it's not only a physical event. We also offer online participations for those unable to attend in persons lah,
I
actually.
see.
And the virtual is open to public who are interested to join.
That
So-
one is open to public.
Correct. So we welcome any publics to orang
Mhm.
kata sit and listens to the expert.
Do they need to register first so they can join in the virtual, or they can just join
I
in that day?
encourage for them to get registered,
Alright.
and they will get the certificates.
Oh, I see.
That maybe useful for their things lah.
Oh, I see. All right, moving on. Maybe you can share about the doctors, specialist doctors that will speak during the symposium.
This coming KPJ Medical Symposium, we bringing 5 specialists. Five specialists,
Mhm.
which is including Dr. Chong itself, which will talk about heart, all right, disease, and also we bringing the physician respiratory medicines, which will talk about the lung cancer awareness, the early detection. We
Mhm.
also bring the surgeons and the Dr. Ramu, so which will be talking about minimal invasive surgery and how to enhancing patient outcome.
Mhm.
Yes, we have oncologist, Dr. Darren, our resident oncologist. We're talking about technology in managing cancer care. And last but not least, we have Dr. Narens is our gastroenterologist and hepatologist. He will talking about gut.
I see.
Yes. So
So-
in total, we have 5
Five.
specialist consultants.
So those are the expert in their field, right?
Yeah.
All right. I want to ask about which East Malaysia region's hospitals are participating in this symposium.
Ours actually, KPJ Sabah actually is the last series of 2024 KPJ Medical
For
Symposium
this year.
for this year actually.
Alright.
So we going to be a closing things for this year lah.
Mm-hmm.
So for this East Malaysia regions, only KPJ Sabah consultants that will be participating in this lah. For information, for the past we have in Southern, we have in Central KL, and we also have it in Sarawak, Southern Johor, and so far for the past 6 KPJ Medical Symposium, we managed to gather more than 1,000 participants.
That's encouraging.
Yeah, we
Response
hope
from the public.
yeah, so we hope this KK will be we get as many as possible the participants lah.
So can you talk about the theme of this year's symposium?
The theme we choose for 7th KPJ Medical Symposium, actually navigating the labyrinth collaborative care. So which mean this theme is to highlight the importance of collaborations with all the parties involved, all the healthcare worker, the GP, the consultant specialists, to make the journey through healthcare challenge smoother and more effective. Yeah.
All right. So that's the theme for this year's symposium, navigating the labyrinth, collaborative care. All right. I wanna move on to Dr. Chong Wei Loong, the heart expert, resident cardiologist, at KPJ Sabah Specialist Hospital, and I want to talk about chronic coronary syndrome and heart failure. So you are the expert on this field, right?
Okay, hi.
Dr. Chong.
Okay. Oh, so for the upcoming GP symposium, I'm going to talk about chronic coronary syndrome. In other terms, we call it ischemic heart disease and heart failure. The reason I choose this topic because heart disease remained the #1 killer in the world for many, many years. It's not pneumonia, not stroke, not cancer. So by giving talk during this session, I hope I can increase the awareness of this disease, and hopefully I can help the listeners who experience symptoms of heart disease. Hopefully I can treat some of you guys. And my topic is about chronic coronary syndrome. So basically, what is chronic coronary syndrome? Is called ischemic heart disease. Another terms we call it coronary artery disease. In general term, we call it heart disease. So what is it actually? It's narrowing of the coronary vessels. These vessels are important because it supply blood to the heart muscles. So what happens is over the years, there's a cholesterol or plaque build up in the artery, causing narrowing of the vessels. So limiting the blood flow to the heart muscles. So imagine like a 2-lane traffic, it merge into 1 lane because of construction. So it limit the traffic. Sometimes it may not cause symptoms, but if the plaque suddenly rupture, it can trigger a blood clot. So when the blood clot, it might occlude the vessels. It's like a big concrete obstructing the traffic. So what happens is the traffic stop, the blood cannot reach the heart muscles, and it can cause a heart attack. There's sometimes you might not have symptoms, but sometimes the first symptoms you may experience is actually a heart attack. That's why we call it coronary artery disease is actually a silent killer. Yeah.
So you talk about the symptom, and sometimes it doesn't have any symptoms at all, right? So what are the risk factors for coronary artery disease, doctor?
Yeah. So before I talk about risk factors, the symptoms. Most of us with this heart disease, we are asymptomatic. We don't have any symptoms. But the common symptoms that we might experience is chest pain. Or we call it stable angina. So what often described is like heaviness of a central chest pain. Like it can be described as someone standing on your chest. It's like a crushing pain.
I see.
Usually happens during exertion or emotional distress, like you quarrel with your girlfriend, or so you get chest pain. So often relieved by rest. So these are the common symptoms. But sometimes you might feel that your effort tolerance become poorer. For example, last time we used to run 2 kilometers, but now you just feel that my stamina is not as good as before. So this might be early signs of heart disease. So some unfortunate patients, their first symptoms is actually a heart attack. Like they come to hospital with severe chest pain. Yeah.
All right.
So the risk factors, there are many reasons or many risk factors that they can cause heart disease, but some of them we cannot control. Some of them we can control. What are the ones that we cannot control? For example, you have family members with similar problem, like you have a positive family history, so you can't control. Like genetic, yeah. Like for men are usually higher risk compared to a women. So men we cannot control. We were born man or female, right?
Men are prone to heart attack.
Yeah, men are more prone to heart attack. But for ladies, once they become postmenopausal, their risk actually increase.
I see.
So these are we cannot control. Like another age, the older we become, the higher the risk. But I'm here to focus more on the one that we can manage. For example, smoking. Smoking is, I think, is very rampant in our country, especially among young men, and also diabetes. We can control our sugar level by taking medication or control our diet. What else? Exercise. I notice nowadays people don't do exercise as often, and also sleep. Poor quality of sleep. I think by having a good sleep, we can reduce the stress level of our body, and also it can reduce the risk of heart attack. So these are the risk factors that we can control.
Good sleep is how many hours, according to you?
In my opinion, I think it's 8 hours of sleep.
8
Yeah.
continuous sleep,
Yeah.
continuous hours of sleep.
Because what we notice that is like when our body is stressed, when we don't get enough sleep,
Mhm.
our body is stressed and the inflammation level go up. So what
Alright.
happened in our artery? Our artery also get inflamed. So when they are inflamed, they become very sensitive, and the plug tend to rupture. When the plug rupture, they trigger a blood clot and cause a heart attack. So by
Mhm.
smoking, increase the inflammation. So I think we need to have a good lifestyle to prevent this coronary artery disease.
All right. Earlier you mentioned smoking, right?
Yeah.
And people nowadays are switching to vaping, right? So can vaping contribute to heart attack? The risk of having heart attack, or how?
Yeah.
Your view.
The cigarette and the vaping, I think they are the same.
Mm-hmm.
They contain nicotine. They contain some toxic substance that can irritate the heart vessel. So, in my opinion, cigarette and vaping are both increase your risk of heart attack.
Mm-hmm.
So I'll advise my patient to stop smoking. Yeah,
All right. The risk almost the same.
it's the same.
It's the same.
I think
Alright.
so.
Moving on. Can young people aged between 20 to 30 years old experience ischemic heart disease? Doctor.
Generally, we see people above 50 years old to get heart attack.
Above 50.
Above 50, usually most of the time it's more than 50 years old because of obesity, diabetes, hypertension, or because of age. But
Mhm.
nowadays, I see more and more younger patients who come to hospital for heart attack. What I observe is like most of them actually smoke. I think
Mm.
smoking is a very important factor in this. Of course, some of them they don't smoke, but they have a very strong family history of high cholesterol level. They have strong family history of heart attack. So these are some of the factors that can contribute to the heart attack. But this heart attack can affect anybody from age 20 to 80.
So
Yeah.
there is no age limit.
There's no age limit. Yeah.
All right. Can you tell us about the test to diagnose coronary artery disease or heart blockages?
There are some tests that we can do for people who are asymptomatic, like no symptoms, but you want to get your body checked. We have a few tests that we can do. We can send some blood tests to check your cholesterol level, check your sugar level,
Mm-hmm.
and then we have other tests like exercise stress test, where you have to run on a treadmill with a heart monitoring on it. And we have also CT scan. For those who cannot run, we have CT scan, very easy to do, and then we can do some calcium scoring through the CT scan, and also we can look at the narrowing of the artery.
Mm-hmm.
Other tests like for those who have symptoms and typical angina symptoms, we can also do the coronary angiography.
Mm-hmm.
It's a minimal invasive procedure through your hand or through your groin.
Mm-hmm.
We put a small little tube and inject some dye and look at the vessels, see whether is there any blockages.
I see.
Yeah.
So those are the tests to diagnose coronary artery disease.
Yeah.
All right. Tell us about the treatment for coronary artery disease, Dr. Chong.
Yeah, I have many patients who come to me say, the moment I start treatment, then am I going to take it lifelong? They are a bit reluctant to take the treatment. But the treatment can be divided into 3 types: lifestyle changes, risk factor management, and also medication.
Mm-hmm.
So lifestyle, stop smoking, sleep well, exercise about like 30 minutes every other day in a week, sleep well, and also don't drink alcohol. But risk factor management, like diabetes, for those who have high sugar level, make sure you take your medication, control your sugar, make sure it's within the limit that the doctor advised. For those with high blood pressure, make sure you take your medication, reduce your salt diet, make sure your blood pressure level is within the limit.
Mm-hmm.
And those with high cholesterol, make sure you take your medication and also control the fat intake, reduce the unhealthy fat like animal fat. Try to increase our healthy fat like olive oil, fish oil. Those are healthy fat. Encourage those intake.
So
Yeah.
switching oils from
eat healthy
animal.
oil.
Eat healthy oils.
Yeah.
All right.
And also don't smoke, most
Don't smoke.
importantly. Yeah. And also there are medications to prevent heart attack like aspirin, the blood thinner,
Mhm.
some statins for the cholesterol. Yeah, for those who have chest pain, we have medication to improve the chest pain. So make sure they come and seek for treatment. Yeah.
All right. Moving on, doctor. Can you tell us about the definition of heart failure? What is heart failure?
Yeah. So for the upcoming event, I'm going to talk about heart failure as well, because I think this disease is underdiagnosed among our population. What's actually heart failure? Imagine our heart is like a pump. It behaves like a pump. It pump the blood from the lung to our body. So it pump the oxygenated blood to our body. So what happens in heart failure is the heart muscle become weakened, the heart become dilated, and also become weak. So the heart couldn't pump as effectively as before. So what happened is the heart couldn't pump well, so the patient might feel tired, and there will be accumulation of the fluid in the lungs. They feel breathless, and also they have leg swelling, abdominal swelling. So this is one of the type of heart failure that I mentioned. But sometimes another type of heart failure is called stiff. You call it heart failure with preserved EF. So the heart is not thick, it's not weak, but it's become stiff. So the heart becomes stiff. It couldn't relax as well as before, so it couldn't pump effectively. So there are two types. One is the poor pumping effect of the heart. Another one is stiffening of the heart.
All right.
But after all, they couldn't. It's basically like the heart become not effective in pumping blood. Yeah.
So who are more prone to heart failure? Is there any specific age group or demographic for heart failure?
So the commonest cause for heart failure is what I mentioned is ischemic heart disease, where there's blockages of the heart vessels. The heart muscles couldn't get enough blood to the heart muscles, so the heart muscles become starved. So the heart over time it become is starved and then couldn't get enough blood and then become weak. So the commonest cause of heart failure is ischemic heart disease. But sometimes I have seen patients with chronic alcohol consumption because
Alcohol.
yeah, alcohol, drink too much.
You must have seen a lot in Sabah.
Yeah, Sabah,
'cause
especially
people like to
Sabah.
drink.
Yeah, beer, whiskey, tapai. So those actually contribute to heart failure. And also some are genetic, we can't change. Some are just strong family history of heart failure, so it can cause. And also valve disease, because our heart, we have valve because of certain valve disease, because of infection in the past. The valve disease actually contribute to the heart failure. The heart become swollen because of the valve. Yeah.
All right. Let's talk about the symptoms of heart failure.
Okay, so what happened is heart failure is a bit different compared to the one that I mentioned. Heart failure, usually my patients don't complain of chest pain.
No chest pain.
No chest pain, because there's no the symptoms are mainly because of the ineffective pumping of the heart, so they feel breathless, so they get tired easily. So they like sometimes they even feel breathless taking a shower. They feel very tired.
It's almost is it almost like the same feeling when you had flu or something? You cannot catch your breath.
Yeah. So flu, correct. But flu usually they are just like transient, just a few days. But for heart failure, usually they are sustained. It's a chronic disorder. So they feel breathless. Sometimes they feel at night they have to sleep with 2 or 3 pillows on the head. They sometimes in the middle of the night they just wake up in the middle of the night. They feel breathless, or sometimes they feel their legs are swollen, abdominal distension because of the fluid accumulation.
Fluid.
Yeah.
Okay.
So for those who don't sleep well, especially like when you sleep on one pillow, you feel breathless. So you need 2 or 3 pillows to make you sleep better. So those are one of the signs of heart failure. Yeah.
What about those people that likes to have multiple pillows during their sleep? I mean,
I don't know. It depends on how you sleep, but for those who feel breathless, this might be one of the signs of heart failure. It might not be heart failure, but it's better to get your heart checked.
So those are the symptoms. Really hard to breathe.
Difficult breathing. Difficulty in breathing. Yeah.
Breathing. All right. How can we confirm the diagnosis of heart failure?
So for
Doctor.
those who experience these kind of symptoms, like difficulty in breathing, your stamina is become deteriorated rapidly over the past few months, so it's better to come to hospital. We can do some blood tests and certain tests like echocardiography, or we
Mhm.
call it ultrasound of the heart. We can look at the heart function, look at the valves, and then we can assess how strong is your heart. Other tests like cardiac MRI is another test to confirm it. But I will still do basic tests like ultrasound of the heart
Mhm.
first to confirm the diagnosis.
So they
Yeah.
can come to KPJ and ask for you, right?
Yeah, they can go to anywhere, but better to come to KPJ than look for me.
All right, doctor. Final words before we move on to Mr. Muhammad Faisal.
So in conclusion, heart disease is very common, and most of the time is treatable.
Mhm.
By taking the correct medication, do the correct test, we can actually improve the symptoms. Whoever experience any symptoms that I mentioned just now, please seek for medical attention. We will try our best to help you all.
You can give Dr. Chong a call.
Yeah, can find me at KPJ Sabah.
All right. Dr. Chong, thank you for that sharing
Thank you.
on chronic coronary syndrome and heart failure. Very important subject. And I want to move on now to Mr. Muhammad Faisal, General Manager at KPJ Sabah Specialist Hospital. And we want to continue talking about the symposium, Mr. Faisal. What other activities that will be held besides talks, and what prizes can be won?
Mhm.
And will food be provided throughout the event?
To make it this symposium attractive and engaging.
Mhm.
So aside the talks by the specialist consultants, we will having quizzes and lucky draw for all the participants, and of course the prizes are exciting. So we have you can win a Garmin smartwatch and so many other fantastic prizes. actually.
Mhm.
Each like I mentioned earlier on, each participants will also receive e-certificates and special packaging,
Special goodies.
special goodies from exclusive for this event symposium
Mhm.
from KPJ Sabah. And apart of that, of course, for the clinicians, the doctors who are joined, the nurses, they are entitled for 8 CPD points will for those all the healthcare professionals. About the food you asked just now, right? No worry at all. Please don't worry about the food. Refreshments and dinner will be provided free of charge to all the attendees.
Mhm.
Just make sure attend and stay until to the end of the events.
All right. Dr. Chong was smiling because we mentioned the food, because he's worried about the people having too much food, right, doctor? Or are you not?
We only serve vegetarian.
Vegetarian. All
No.
right. All right, Mr. Muhammad Faisal, how can the public join the symposium?
It's very easy actually. The people, those interested can just visit KPJ Health official website, or also can visit KPJ Sabah Specialist Hospital official social media account on the Facebook, Instagram, LinkedIn, and so in there we provide the link for the registration, and also we provide a QR code to register. Just scan and fill up a few informations, your name, telephone number, email address, and also your clinics. Things.
Just basic infos, right?
Correct.
They don't need to pay anything, right?
No need.
They're worried when they see any numbers they need to pay. They're like distancing themselves. Anyway,
Yes.
that's Mr. Muhammad Faisal and also Dr. Chong, resident cardiologist at KPJ Sabah Specialist Hospital. And if you are excited about joining the KPJ Medical Symposium 2024, mark your calendar for November 9th, 2024 at the Marriott Hotel Kota Kinabalu, Sabah from 8 a.m. to 5 p.m. and don't miss out the chance to register for free on KPJ's Instagram, Facebook, LinkedIn pages, all their social media sites, and get ready to win fantastic prizes, including what Mr. Mohd Faisal mentioned earlier, a Garmin smartwatch, and whether you prefer to attend physically or virtually, this is a great opportunity to earn 8 CPD points for general practitioners and doctors. Non-medical participants can also look forward to winning quizzes, receiving an e-certificate, and snagging goodie bags. All right. Thank you once again, Mr. Mohd Faisal, General Manager at KPJ Sabah Specialist Hospital, and Dr. Chong Wei Loong, Resident Cardiologist, talking on the upcoming KPJ Medical Symposium 2024. Thank you.
Thank you so much, Mr. Alfie. So
All right.
we're looking forward for KPJ Symposium 2024.
All right. We'll see you there.